So moving on swiftly, we've tackled on so many issues that are not issues rather, but the work that we do as young people. And it's now important that now when we're seated here at the table actually, and trying to, not trying rather, but actually executing the work, it's best to also understand the work that also we do as young people and how best we can move forward. So first is Selma. Okay, so Selma, we do have a few questions for you that are involving HIV and SRHR human rights barriers. And so for starters, maybe you could provide with us an overview of your subject and explain why it is important to tackle human rights barriers in order to overcome the unmet needs of youth in HIV and SRHR spaces. Yeah.
All right, am I audible?
Yes.
Thank you. I think for the first few sessions of the day and one that just goes wrapped up right now, it spoke more about the statistics of where we are as a continent and as a world in terms of a lot of key populations being at risk or are contracting HIV. And this is why we then have the conversation of human barriers, because I think I'll then first start off with categorizing the various or the different types of human barriers that we have. The first one would be stigma and discrimination. The second one would be gender inequalities and gender-based violence. Whilst for the third one, that's now punitive laws, policies, and practices. And as the statistics indicate to us, they are barriers, because why do we have so much investment yet the statistics are still high? Why do we need to address these barriers in order for us to move forward? Because if you want to achieve an AIDS-free generation by 2030, then we definitely need to take a look at these barriers, because they are the ones that are hindering those key populations and those young people from accessing these services. And if we are going to continue investing in these programs, if we are going to continue investing into these initiatives that aim to now educate young people, also provide service provision to them, then our investment is going to waste, because it doesn't help putting the services there if when I go there as a young person, I'm being discriminated or I'm being questioned about, why are you having sex at 17, instead of actually focusing on giving me the contraception I need, educating me in terms of how do I protect myself. So it's important for us to get rid of these barriers in order for young people to access these services. Another one also looks in terms of accessibility of these services again. If you look at vulnerable populations like young people living with disabilities, yes, we have facilities available, but these facilities accommodate those young people. Those are some of the reasons why we need to look at those barriers, remove them, because we can't continue to let investments go to waste. Young people are contracting HIV on a daily basis because investments are just placed there and not suitable for young people. And I think that would be my key takeaway or my key concern as to why we need to remove human barriers that exist. Thank you, Ruel.
Thank you so much, Selma. And while we're still at it, and when looking at the work that you do, and especially when it comes to creating content, and when it comes to talking about HIV and SRHR in such spaces, I would really love for you to share with us today about what it is at your own capacity as a young person you have done to create the said change.
All right. Yeah. So as per my introduction, what I do on a daily basis, or what my full-time job looks like as podcasting, right? So I try to create safe spaces where young people can openly have conversation on sexual reproductive health related issues. These are now issues or concerns that we can't have these conversations with our parents. We can't have these conversations with another young person, because there's still that stigma, there's still that fear of, what if they look at me and they say I'm having sex? So on the podcast, you can easily get to share your experience. You get to hear from other young people. And we also then ended up having a space where young people come to vent. You have what you call our website, whereby young people can chat to us, or our various social media platforms. And young people come to us and say, oh, so I went to the government facility and they said I couldn't get contraceptives. Are you guys maybe able to just go there with me? Or are you guys able to tell me what are the current laws that we have in the country that allow us to get contraceptives? So that's more of educating them in terms of what their rights look like. It's also providing a platform where they can also then be able to share their stories, because as young people, I've realized that we love to hear from other people. We love to relate to other people. So seeing Gosa share her story or seeing Ruel share their story actually says, oh, I'm not the only person that is going through this. Somebody else is going through it. It's normal. And we have people that go to the extent of they shy away from having the conversation. But this is due to cultural norms that they've also grown up with. But then as time goes by and they listen to these episodes in their own time, during their own free will, so it's not going to be a thing of other people get to see us. So when they listen, they also get to move away in terms of cultural shifts and social norms of what is acceptable and what works for them. And they also get to connect with other young people through that same platform. So for us, it's more of educating, empowering, and providing young people with a platform where they are best comfortable, because young people love social media. You find us on our devices, and that's what I do on a daily basis. Thank you, Ruel.
Thank you so much, Selma. And it is also an honor of me to say that Selma has hosted me in her podcast episode. So yeah, my time to shine has already ended. So Selma, as we're finalizing on your panel question this afternoon, do you have any final thoughts on how best we can engage young people to be part of the solution rather than the problem?
Well, I think the first thing that we are going to say, if you're going to engage us as young people, start from when you identify what the problem is. Don't design the programs for the young people assuming what they need. They might need it, but the approach that you are using is actually not the correct one to get to them. So always involve young people from the initial stage. Another thing is, leave your cultural and religious belief out of serving young people, because unfortunately, as an elder or as somebody that comes from a different cultural background, what works best for you or what has been working for your generation is not what works for us as AMA 2000, as most of us call us. We have different ways, we have different approaches, and unfortunately, maybe it's also a thing of time. In the past, people were sexually active in their late ages, but now you find someone as young as 13 saying they're sexually active, or they don't identify with, they don't identify as what you see them for. So allow them to speak who they are, don't decide what they are, and then the next thing would be give them the necessary services that they need. Because the reason why they're coming to the facility or they're reaching out to you is because they need the services, not because they are young people and they can't be at the health facility. They need it, so don't let investments go to waste. Provide them with the necessary services, and if you can, educate them on how they can do better and ensure that what was then avoided, as in HIV prevention at birth, does not result in a young person contracting HIV when they are older and they could have done better. Thank you.
Thank you so much. Can we clap hands for Selma and some drum rolls for young people? I know that you've been clapping hands, and can we kindly practice something new? Clap hands, young people participate and do some drum rolls in a count of 1, 2, 3. Well, that was lame, but let's wait for the next one. Thank you so much, Selma, for highlighting the major HIV and SRHR human rights barriers. So now we'll just move on to our second panel speaker, Aman Shukla, all the way from India. So Aman's topic is mainly focusing on young key populations. And let's launch our discussions, Aman, to our first question. How do we define young key populations and their diversity, just to frame the whole understanding? Sure.
So young key population are an individual typically between the age of 10 to 24-year-old. And this population are very much at high risk of HIV vulnerability. This group includes of people who have sex with men, men who have sex with men, people who use drug, people who are engaged in sex work, people who are identifying themselves as transgender community, and there are many more community that are there, but that differs from countries to country. These communities are very much vulnerable to the HIV because of the decriminalizing policy and unfriendly approach in the countries, in the region, and globally. The key population always face and stigma and discrimination and violence, and hence this impact a major into their access to HIV and SRHR services. We all have seen that key population are there with us. They are around us, but we never talk about this. It's us, youth reference group, who are talking about and want to understand the specific issues and challenges. We know these community exist, but we don't want to talk about them. We don't want to highlight their issues. We don't want to work for them. Maybe because we are fear of the punitive, decriminalizing law that decriminalizes same-sex marriages, decriminalizes the drug use, decriminalizes the sex work, or the individual identify themselves. It's very much important for us to understand key population means to end HIV. Key population are key to that lock to end HIV. Also, when we talk about diversity, so it does not, and key population can be from any community, but it's an overlapping and encompassing encompassing their typologies. For example, an MSM can be an ID user, an MSM can be an PLHIV, a sex worker can be a PLHIV and can also be a ID user. So key population, irrespective of their sexual orientation or gender diversity, they are diverged into the culture also and gender norms also. So this is very important that we need to understand what is key population.
Thank you for making us understand, Aman. To our second question, do you think harmful social, cultural, and religious norms affect young key populations' decisions and their rights to access HIV and SRH services?
Yes, I completely do agree. Like I mentioned, that harmful and social norms that affects key population is mainly these population are excluded, are left behind in while we are in the society, in the while we are designing the program everywhere. So maybe because the social norms exclude them because of their cultural issues, because of their punitive laws that they have, that they restrict. And also very important thing is that this community, wherever they exist, wherever, like for example, if I can give an example of since we are in African continent, in Uganda, everybody must be knowing that Uganda has a very strict law for people, those who belong to LGBTI community. For accessing services for them is a huge barrier. Also, there are many other countries in the world that restrict them to access services. So, of course, social norms, gender norms are very much vital to impact their access and decision making to access the services of HIV and SRHR.
Thank you so much, Aman, for sharing those well-rounded insights. We really need to listen to these young people because they are addressing the unmet needs in the HIV and SRH spaces, and we hope to get your undivided attention as much as you're doing at this moment. So before we go to our last question, Aman, can you kindly maybe list a few leading challenges that prevent young key populations from accessing quality health services in the HIV and SRH care? You can talk from a country, region, to a global context.
So what, like I said, what restricts key population to access the services is legal barriers. And second thing is the health facilities where they access the services, they are not aware about key population. Often they find it stigma and discrimination at the facility level. To prevent this, we need to work in partnership and in collaboration with NGOs, civil society, CBOs, international organizations, and do a rigorous advocacy with the policymakers, bureaucrats in the country at the regional level or at the global level, because this is very much important. It's when a population is facing a barrier to access the services, where it is coming from, that is very much important. If a country has a friendly support for the community, then it automatically, when it comes down to the society and to the community, it breaks all the barriers. If we have a friendly law, then it will create an eco-friendly system within the community also and within the society also, to provide them the services, because they have been protected by the government and supported by the CBOs and has the peer support from the community.
Thank you so much. I know that you covered my last question, though you didn't listen to the question. I don't know, do you have any final thoughts that we can ingrain as young people? How best can we demonstrate change as young leaders?
So we as young leaders can do an advocacy to reform the policies, to work on the policies, advocate and understand, make them understand about the key population, why they are important, why they are key to HIV, why this community need to be prioritized. Okay, so my call for action for this, what I can suggest is, we as an advocate, as a young advocates, we should do the policy reform advocacy with the governments. Also bring out the human stories, lived experiences, so that they can understand well and have the evidence in their hand to make some decisions for the community. Thank you.
Amazing. Let's appreciate Aman. Drum rolls, drum rolls, drum rolls. Yo, forgotten my drum rolls. Okay, we're gonna do the drum rolls, guys. Come on. Exactly. Amazing. Thank you so much, Aman, and to everyone. So moving on swiftly, and also just to be mindful that we're also going to have a few Q&A session. So should you be having any question to any of our youth reference group members, please have it on a placard ready. We're coming to you shortly. So Cinthia is going to be here to tell us a little bit more about stigma and discrimination. And to begin our discussion, Cinthia, I would like to learn about your regional to global perspective on stigma and discrimination, as well as why we continue to hear stigma and discrimination as the leading setback in HIV and SRHR care.
Okay, thank you very much. Good afternoon to everyone.
Good afternoon.
Okay. From a Cameroon standpoint, stigma and discrimination remains a significant barrier in HIV and sexual and reproductive health rights. Despite the effort, the sensitization, and getting young people aware about HIV, stigma still goes on. This stigma does not only affect individuals, it affects the general population and especially those living with HIV. Due to deep-rooted cultural beliefs and misinformation, this stigma has, due to cultural and misinformation, stigma and discrimination has remained a great problem in my country, Cameroon. Years back, HIV was seen as a deadly disease, and as if you're being termed HIV positive, it shows that you are sexually active and you have been going around and sleeping with men, which has been the mentality of a lot of people, causing stigma to continue going in Cameroon. And from a global perspective, stigma and discrimination are recognized as a major setbacks in HIV and sexual and reproductive health rights. They hinder access to services, discourage individuals from disclosing their HIV status, and perpetuate a cycle of fear and misinformation. The UN/AIDS report highlights that stigma and discrimination are among the top reasons why people avoid testing and treatment. Understanding how stigma and discrimination differ across different countries can reveal patterns, which can help other countries to grow, because Africa as a whole, there are other countries where stigma and discrimination isn't looked upon as something that big. We can talk of South Africa. South Africa compared to other countries, or should I talk of Cameroon? South Africa is far more ahead when it comes to stigma and discrimination, and learning from them or getting their point or how they got to that point can actually help other countries overcome stigma and discrimination. And why we continue hearing about stigma and discrimination as a leading setback in HIV and sexual and reproductive health, one of the things we have societal norms and belief. Like I said, the belief that HIV was a death sentence, and when you're HIV positive, you're supposed to be as tiny as a broom, you are supposed to look cranky, and you're supposed to, I think you are not supposed to have a life, has been the brain behind when someone hears of HIV, that is the picture they have in mind. And in as much as sensitization is going on, advocacy is going on, it is so difficult to penetrate the minds of some people from the community or around. We have fear and misinformation. Throughout my journey as an advocate and as a person living with HIV, I have done a lot of sensitization, and getting into the community, you see that people are not aware of what HIV is all about. They have a mindset, they have informations that are not right, they have myths that they have put together and they are believing, and most of the time it is so difficult to penetrate these myths and beliefs that they have. Some of them are so bent on it and believe the healthcare society or the hospitals are framing up everything we are talking about. And we have historical context. It still goes to the point of way back in the 1980s to the 1990s where HIV was a death sentence. And then we have access to services. Discrimination in health settings can deter individuals from seeking necessary care. Most adolescents and young people are scared and afraid to go to the hospitals to get the necessary services that are needed by them, just like Selma spoke about it. They are afraid to be judged, because when an adolescent comes and it's like, I will need a condom, it's like, what are you doing with condom at this age? You should not be using condom. So they are scared to access these opportunities. And we also have lack of representation. Underrepresentation of affected communities in health policies and program design can lead to services that do not meet their needs. At some point, we don't have enough adolescents and young people seated on those tables that decision-making that concerns them are taken. We have people that take decisions for us and detect on how we are supposed to live and how things are supposed to be done. And if adolescents are placed on these tables and policies are being made regarding what they need and what they want, stigma and discrimination will not be everywhere like this. Thank you.
Amazing. Thank you so much, Cinthia. And I really love that you've touched on much of the social aspects around stigma and discrimination. But now, if we can answer it very briefly, what are the specific areas of care, specifically towards care, that are mostly affected by stigma and discrimination in HIV and SRH?
Okay.
Very briefly, yeah.
Thank you very much. The specific areas, we have teenage pregnancy. Adolescents and young people live with HIV who gets pregnant, maybe not married, face a lot of discrimination and stigma right from their homes to the hospitals and the community, because you're already HIV positive, and at some point you see yourself with a very big stomach, and there is no man standing somewhere to take part or be part of that pregnancy, and the community is asking why, and the hospital is asking why should you be pregnant, and your parents are telling you, we invested a lot in you, and this is what you have to give. And the community as well is saying, you cannot go to school, you have to stay back home, your education has to stand, and stuff like that. We also have access to commodities, contraceptives, and health products. Contraceptives and health products are actually available because I know they are the organizations that make them available, but I don't think they are available to the adolescents, because you barely see, like it is said, an adolescent is supposed to have a condom. It's you are supposed to be in possession of a condom, but in most cases you have adolescents who cannot have those condoms. And awareness and education, we have discriminatory attitudes can limit educational outreach about available commodities. And due to this stigma and discrimination, some of us don't even know the available commodities, those things that are meant for us. Because first we are stigmatized, and we don't want to ask questions, because if we ask questions, more stigma is going to come. We also have limited mental health and counseling, and we have testing and diagnosis, where HIV and STIs testing, fear of judgment can prevent teenagers from seeking testing for HIV and STIs, leading to late diagnosis and spread of infection. And we also have confidentiality concerns. Stigma surrounding sexual health can discourage teens from accessing necessary diagnosis services, fearing breaches of confidentiality. Thank you.
Amazing. Thank you so much, Cinthia. And lastly, maybe you could tell us, in your country, Cameroon, yeah, what should you wish to see to be able to end stigma and discrimination in Cameroon? Yeah.
Okay, in Cameroon, actually, stigma and discrimination is not a one-person fight. It's supposed to be a collaboration of a lot of people in order to combat stigma and discrimination. So in my country setting, first of all, I would want to see adolescents being empowered, because stigma comes from within and from the community. And the stigma that comes from within you can actually kill you more than what the community is going to say or do. So first of all, we have to empower the young people on how to stand up for themselves, accept themselves for who they are, first of all, before the community. And we also want that adolescents and young people should be given the opportunity and the spaces, especially when it comes to policy making, so that they can bring out those policies that will safeguard and protect them when it concerns stigma and discrimination. Because at most settings in Cameroon, they are actually, there's work going on when it concerns bringing adolescent young people to these spaces, but I think it is not enough. Yes, enough has not been done. So adolescents and young people should be brought to those spaces. I don't know.
Thank you so much. Can you clap hands for Cinthia and the drum rolls? Don't forget the drum rolls.